Hello and welcome to another edition of the Connecting Me to Uni Power Up micro lecture video series with me, Michael Cole. Why is it called a Power Up? Well, basically, if you're studying with us and you use this in conjunction with your directed reading and your engagement in classes, it's going to help you understand the theory and practice of the topics. Today, we're going to be talking about gender, toxic masculinity, and what relevance they have to sports physical therapy. Now, as a reminder, you've been given your directed reading. So in that top section with the red light there, that's the kind of minimum we'd expect that you'd be engaging with to help understand what's going on with these sessions. So, professionalism, gender and masculinity in sports physical therapy. Well, I'm going to recap very briefly on what professionalism is and what it means for us graduate sports therapists. And then I'm going to show you how masculinity and ethical practice is linked to that, so we all understand why it's necessary to have an understanding of it. Okay, so what is a healthcare professional? Well, first of all, let's think about healthcare. So there are three concepts here of a graduate sports therapist, but for any kind of allied healthcare professional, the first is do no harm. We have to be safe, we have to be competent, and we have to be effective. And we're talking about others, i.e. patients, but also colleagues and ourselves. This requires some ethics. So healthcare professionals have to be truthful, honest, have good moral standards and be of good character. Now, of course, who defines what good moral standards are and who defines what good character is? Well, these are contestable terms, and it's why we have to be critical and reflective as healthcare professionals to ensure that we meet the demands of the industry, but also our profession. So, talking specifically here about the Society of Sports Therapists, and in another micro session we'll do a lightning recap of the Code of Conduct, Performance and Ethics and the standards of proficiency. But for the time being, we need to be just familiar with the fact that when we talk about healthcare professionals, we have to fulfill the remit of that society, our accrediting body. We are allied healthcare professionals and we have to be obviously aware of legislation. So, what does it mean to be a professional? Well, as we've said, competent, we need specialised knowledge, we need to be accountable, self-regulated, etc., etc. I've put some in blue here because in a moment we're going to see why they might be a little bit more appropriate for the topic we're learning about today, i.e. toxic masculinity. So, when we're interested in healthcare, we have to be interested in equitable healthcare. Otherwise, we might be reinforcing systemic inequalities. All right. This means that we have to be focused and centered on the patient, but we must also be understanding structural and interpersonal inequities. Okay, things like racism, ableism, sexism, classism, etc., etc. Okay, if we're not aware of those, there might be issues for how equitable we are in providing our services to the full diversity of our patients and allowing them to participate fully and demonstrate their understanding, autonomy and self-direction in their care. So we've just seen here what is a professional and why equitable practice is so important for us to have an understanding of. Now, if we were to focus on masculinity, for example, and we'll leave aside kind of the other issues of oppression for the moment, we can see that masculinity involves this kind of concept of power and dominance. There are certain standards and norms of what a real man should or should not be. And this will kind of fluctuate and morph depending on the context. So depending on the culture, the country, the time in history, etc. But what we'll see is that the general thing that links it together is this concept of access, value and privilege that men have and women don't, and where women are viewed as lesser. And I'm not talking consciously necessarily here, but these things are embedded, as we say, interpersonally, but also structurally. Okay, this concept of masculinity, if taken to a toxic level, will affect our relationships with ourselves, with our significant others, but in this context, our co-workers and patients, all right, or our student peers as well. If we can get a better understanding of ourselves, it will help our health and lifestyle, and it will help our health of our patients as well, be it seeking treatment, be it how we engage in our assessment with the patients, and seeking help and referral services. So a very quick snapshot of what it means to be a professional and why masculinity might be something to consider. So toxic masculinity, a definition for you. These are the cultural norms that are associated with harm to society and to men. So it's not all masculinity. It's not saying masculinity doesn't have positive characteristics or outcomes, but there are certain aspects that might be harmful to ourselves and others. You might also see the term sometimes traditional masculinity ideology, but I've put traditional in air quotes there because whose tradition are we talking about? That might be a very westernized concept. Anyway, these set of oppressive behaviours and beliefs, for example, suppressing emotion or using violence, confrontation and aggression as indicators of power. And this toxic masculinity might be a manifestation, shall we say, of the patriarchy at work. And the patriarchy, again, a social system in which men hold primary power, leadership, privilege and cultural norms and customs that favour them over women. Now again, this is not saying that all men have privileges. It's not saying that men don't suffer or struggle. It's just saying that on balance in a given situation, men tend to hold the power and exert influence. That benefits them at the expense of women. It could be considered part of the hierarchy, which basically expands that system of power, domination, and oppression to include things like racism and capitalism and ableism. I would argue they are all the same thing. They cannot function without each other. So we know that toxic masculinity exists. There are well-known gender patterns in things like violence and abusive behaviour and gender bias and inequalities. Things like being put in prison, higher incarceration rates for men, higher suicide rates for men, early mortality for men, more severe and harsh discipline for boys in schools. And then in terms of careers, career bias, so less earnings, less progression for women. Women are more likely to be the victims of domestic violence and sexual violence and harassment from men. So these are the patterns that we're talking about. So is this a thing? Well, back in the year 2000, the World Health Organization acknowledged the need to pay greater attention to the shorter life expectancy of men, and it said that this role of masculinity was fundamental as a causative factor for this health disparity. So yes, it exists. And then last year, with 13 years in the making, the American Psychological Association published their first ever guidelines built on over 40 years of research showing that toxic masculinity is harmful and causes damage to men and to others in society. So we just need to remember, as I said earlier, there are different manifestations of toxic masculinity. It's not saying that it's the same all the way around the world, but there are some commonalities between them. But recognising the differences is crucial to trying to solve this issue. If we talk about university, we talk about this type of violence that exists on campus, be it self-harm, sexual assault or other forms of interpersonal violence. And there's a wealth of data showing that this does happen in universities. And there are insufficient spaces for conversations about how men deal with emotions and conflict. So, as a healthcare practitioner, being at university then graduating, we have a responsibility to help create spaces for men and by extension ourselves and women to unlearn some of the notions that have had such or led to such profound harm. So, physical therapy, let's look at that. It represents a field of practices where contradictory and covert social expectations reside. So, physical therapy doesn't exist in a vacuum outside of these structural influences and oppressions we talked about earlier. In fact, it reproduces them, okay? And we need to be aware that as healthcare practitioners, we should be aware of these dominant masculine ideals, particularly around sports and physical therapy and exercise. We should be cognizant of our own potential biases. Okay, we don't want to be mistreating or doing harm to patients or our peers without knowing it. We need to recognise the integrated nature of masculinity and how other factors interact, like disability, age, class, sexuality, etc. We need to understand how privilege and sexism work by conferring benefits to men, not all men, but benefits to men, and trapping them in certain roles. We need to consider how there's a reluctance to admit vulnerability, all right? And this may have a direct impact on the patients that we're consulting, or who are consulting with us and our development of our therapeutic alliance with them. And we all know that that therapeutic alliance is absolutely vital to successful care. We need to beware of aggression and other externalizing symptoms can mask problems. Okay. Be aware of referral services that are sensitive, so support services and referral services that we can perhaps refer people to if they need further help. So what does the science say about all this in terms of physical therapy education? I'm a lecturer, your students on the programme. Well, gender, the concept of gender in physical therapy education is somewhat ambiguous. It's not really made explicit at the moment. It's physiotherapy, as an example of a physical therapy vocation, is historically a women's profession, yet recently more men are getting involved. We know that mass media, particularly the sports media, portrays a masculine, sporty image of physical therapy, which ignores the presence of women, or in some extreme cases and the worst cases, sexualizes or objectifies women in and around the area. So this raises questions about tensions and contradictions in your education. It raises questions about the teaching practices that may reinforce those inequities. And Hammond in 2013 stated, program leaders, module leaders, academics in these areas need to increase awareness amongst peers and managers of possible sites of gender inequalities within their curriculum. They need to debate gender issues within lectures and wider spaces to help develop better understandings of gender. And they need to provide inclusive spaces within the curriculum to talk about and challenge these forms of oppression. And you can see on the right here some different gender identities. It's not all of them, but it's some of them. And speaking as a non-expert in the field of gender and identity, this was really helpful. This was in in fact in the Teen Talk recommended reading on the second slide of this session. Found it incredibly helpful to get a better understanding of what my patients might be identifying as. So why discuss toxic masculinity in your physical therapy education, in your sports therapy degree? Well, there are gender differences in preferences that we have seen in the research for students in terms of what work they want to do and careers they want to take on. There are differences in how we award or how grades are attained, specifically in the practical components on your physical therapy degree. Gender, as we said before, is rarely explicitly discussed. It's kind of ambiguous. People want to stay away from it. But your identities, students' identities, are constantly negotiated through relationships as you learn. And the discourses, the discussions and views around what is normal for gender, in inverted commas, demands of you to either accept, assimilate or resist. Okay, and you can see here that if you're, depending on whether you're accepting, assimilating or resisting, will have an impact on how equitable your education is, and you're all paying the same fee, right? Let's make it fair for everybody. And there has a struggle for some to be recognised within physiotherapy education and practice. So again, if we look on the right hand side here, again, I'm no expert, but it's very, very clear to see that gender is absolutely socially constructed. Sex, even when determined biologically, is not binary. There's at least 6 different ways biologically of assessing sex. So it's not a binary concept, okay? And depending on the cultures and histories, etc., there's lots of different ways to look at these things. So please do have a little further look at these things. And if you are a man who wishes, or you identify as a man who wishes to find out more about how to talk about these things, how to confront it, how to make things better for yourself and others, these are some examples of some organisations that you might want to have a little look at. You might also want to come to our BEAT sessions. This is an example of one of them. BEAT is a group that is a collaboration between students and staff. There are no power differences, or we try to minimise them as much as we can. And we don't just talk about masculinity, but it does come up sometimes. Get yourself involved and we'll get some benefits from that. So thank you for watching and listening to this latest instalment of your micro lecture video series to help power you up, connecting me to you. I'm Michael Cole. You can see there at Cole Therapy Ed. Please do follow. Please do comment if you would like to. And we'll see you soon for the next instalment of the Micro Lecture video series.